Hello everyone, myself Meet Sevak from Harvard University. Today we are going to discuss about the derived positions. So, what is derived position? In this position, the boot cuts and the thighs which are supported on supporting surface such as stools or chairs, hip and knee are flexed to 90 degree, feet supported on floor so that the ankle lies just under the knees. Now muscle work. Both the limbs are supported and the pelvis is supported and it's stabilized by the body weight so that no muscle work is required. The postural muscle of upper body works balance the effect of gravity and maintain its effect. Now effects and uses. It is very stable, comfortable position. It allows the free movement of upper limbs and the neck in all directions. So it is the most important used functional positions. It eliminates the weight bearing on the lower limb so that the suitable positions for the patient who finds difficulty in exercise in standing positions. Now DI position from sitting. These are divided into 6 different types. So first one which is long sitting, second group sitting, side sitting, cross sitting, high sitting and forward lean sitting. Now let us discuss about the long sitting. It is assumed on the floor or on the plinth. In these positions, the patient sits with legs stretched in front of the body with both knees which is extended, hip is flexed at 90 degree and the ankle which is held in dorsiflexion. Now muscle work. Muscle of the back work to keep it straight, maintain the normal ligament alignment and the legs which are supported on the surface so that no muscle work is required to quadriceps. Many may work to counter and then increase the tension of the hamstring muscles. Now effects and uses. This position stress the muscles of back of the thigh so that so many flexibility exercises which are performed from these positions. This is the positions by which the long sitting is performed. Now crook sitting. When knees are flexed from long sitting positions, it is known as the crook sitting position. Now muscle work. Muscle of the back work to keep it straight, maintain the normal alignment. Flexion of the hip and knee which work to hold the flexed leg. Plantar flexion of the ankle, fix the feet to the floor. Now effects and uses of crook sitting. The lumbar spine and the pelvis which are fixed in these positions so the movement can localize to upper trunk as in the treatment of spinal deformity of this region. Now cross leg sitting positions. In this position, the patient is on the floor or on the plinth. From crook sitting, the hips are strongly abducted and laterally rotated with both the knees which are flexed. Both the legs which are crossed from each other and ankles come to lie just beneath the opposite leg. Muscle work. Muscle of the back work to keep it straight and maintain its normal alignment or ligament. Flexion of knee, which is abducted, and lateral rotation of hip maintain this position. Now effects and uses of cross leg sitting. This is very commonly used position in traditional Indian lifestyle. This is commonly used in Indian lifestyle. In such homes, the people used to sit on floor and eat their daily hygienes and foods. It improves the flexibility of lower limb. It stretches the hip adductors. Then the side sitting position. For side sitting on the left leg remain as in cross leg sitting. The right leg adducted and medially rotated. The knees are bent so that the leg lies on side. The weight of bone mainly on the left hip. Effect and uses. This position is used to increase the lateral mobility of lumbar spine and the treatment of scoliosis. This is side sitting position. In this, the whole body weight is on left pelvis. Now stoop sitting and the forward lean sitting. From fundamental sitting positions, the body which is lean forwarded or stoop sitting, the arm may be floored and supported on the table and the forehead which is raised on it. Then forward lean occurs and allowing the back muscle to relax. Effects and uses. Forward lean position is relaxed position for the patient with breathing problems, so that they are used for patient with respiratory problems. This is forward lean position. In this, the back which is relaxed, the head which is slightly upward, so that it is comfortable to breathe or in respiratory patients. Now, high sitting. This is the fundamental sitting position when which is assumed as the high plinth or table. The feet remains unsupported. In this position is known as the high sitting positions. Feet may be held dorsiflexed or allowed the plantar flexed under the effect of gravity. Then effects and uses. It is used for some foot and knee exercise. This is high sitting position. So this was my presentation on derived position in sitting. So thank you for watching this video and have a nice day.